This video is gait belt training for patient care. This is a gait belt that can be found at your hospital's supply distribution area. Gait belts are single patient use and are to follow the patient throughout their hospital stay. Gait belts are used to help shift and recenter body weight during loss of balance or assist with unexpected controlled descent to the floor. A gait belt ensures clinician and patient safety as it provides a point of contact for the clinician and minimizes excess strain on a patient to prevent pulling on an extremity. A gait belt has teeth and a loop that looks like a buckle. When placing the gait belt on a patient, be sure the tag is facing away from the patient. Go through the teeth, tighten, and pull through the loop, tucking any excess inside the belt. When holding the gait belt, the clinician's hands should always be palm up with fingers between the patient's back and the gait belt. As often as possible, the clinician should try to use his or her dominant hand while guarding the patient. Ambulation and controlled descent to the floor. If the patient loses balance, the clinician will engage dominant hand on gait belt, using assisting hand to pull the patient close. Clinician should bend his or her knees, keeping back straight while slowly lowering with the patient to the ground safely. When assisting a patient into standing, the clinician should never pull on a patient's extremity to avoid harming the patient. Contact guard assist transfer to bedside commode. Position the bedside commode at an angle towards the bed. This will minimize the distance between the bed and the bedside commode. Ask the patient to roll onto side, slide legs off the edge of the bed, use arms to push into sitting, and place feet on the floor. With tags facing out, position the belt slightly below the patient's waist. Insert the tail through the teeth, tighten, and pull through the loop. Tuck any excess inside the belt. In order to ensure clinician safety, follow proper body mechanics. Maintain close proximity to the patient, bend knees, maintain a straight back, and move with the patient. One person assist to wheelchair. Position the wheelchair at an angle towards the bed. This will minimize the distance between the bed and the wheelchair. With tags facing out, position the belt slightly below the patient's waist. Insert the tail through the teeth, tighten, and pull through the loop. Tuck any excess inside the belt. With clinician close to the patient, ask patient to scoot hips towards the edge of the bed and place feet on the floor. Clinician immediately uses knee to block the patient's knees to prevent sliding off the bed. Once clinician and patient are in a safe position, the clinician moves in front of the patient. Use proper body mechanics. Maintain close proximity to patient, bend knees, keep back straight, and move with the patient. Clinician's hands go around patient's waist, holding the gait belt at the patient's back. The clinician's hand palm up with fingers between the patient's back and the gait belt. Position the patient's head in the opposite direction of transfer. Ask the patient to give a strong hug, and when patient and clinician are ready, slowly rock into standing and move with patient to wheelchair. Two-person assist chair to bed. Position the chair at an angle towards the bed. This will minimize the distance between the chair and the bed. With tags facing out, position the belt slightly below the patient's waist. Insert the tail through the teeth, tighten, and pull through the loop. Tuck any excess inside the belt. Clinician 1 stays close to the patient and encourages the patient to scoot his hips towards the edge of the chair. Clinician 2 assists patient to one side, while Clinician 1 uses chuck sheet to draw patient's hips forward, alternating sides until the patient's hips are toward the edge of the chair. Guarding the patient's knee that is closest to the bed, Clinician 1 assumes proper body mechanics. Maintain close proximity to patient, bend the knees, keep back straight, and move with the patient. Clinician 1's hands go around the patient's waist, holding the gait belt, with the clinician's hand palm up with fingers between the patient's back and the gait belt. Position the patient's head in the opposite direction of the transfer. Clinician 2 positions self between the chair and the bed, using foot to stabilize the chair. Using proper body mechanics and hand placement on the gait belt, Clinician 2 assists patient to lean forward in preparation for standing. Ask the patient to give a strong hug, and when patient and clinicians are ready, slowly rock into standing. Clinician 1 moves with the patient to bed, as Clinician 2 guides the patient's hips from behind, switching hands to complete safe transfer. Clinician 1 continues to guard patient's knees until patient is securely sitting in bed. Mechanical lift equipment. If the clinician does not feel comfortable, or if extra help is not available to transfer the patient safely, the following lift equipment is available on hospital floors. Please contact the charge nurse on the floor to locate the nearest mechanical lift and lift slings.